it going online?
You started?
No. Check it on YouTube.
You can click on full screen. Full screen. Green color option.
When?
Green color option. Green.
Okay. Just check whether YouTube it is broadcast. So, yeah, clear? Okay. So, good evening to everyone and welcome to today's session. We have Dr. Yash Ramanaj. Dr. Ramanaj, you are from which place?
Sir, I am basically from Gujarat, Ahmedabad, but recently I am living in Delhi.
Wow, that's good.
I
And
have completed my MBBS from Ukraine, sir.
oh, very good. That's wonderful. And you all know our old friend Dr. Prasoon Vaidya from Nasik, and we are expecting some more students. So the whole idea of the today's session is we will all be interactive. We get an opportunity to prepare for the questions and be able to add 2-3 points so that there is a drive for preparation. So with that preamble, let's make the great beginning. Normal intraocular pressure. Who is going to give me the answer? Sharath is not there. In place of Sharath, somebody can answer. Any guess? Prasoon or Ramanand?
Sir, 10 to 20.
10 to 20?
Option B.
Okay. So it is 10 to 20, absolutely right. Now, shallow anterior chamber, where do you see Ramanaj?
Phacomorphic glaucoma.
That's good. Any points you like to add on that? Very good. So,
Sir, acute closure glaucoma.
okay. So, phacomorphic glaucoma is a secondary angle closure glaucoma because of the lens intumescence. So that is the main underlying cause of the phacomorphic glaucoma. And yeah, you have someone waiting. Yeah. You don't have a setting where automatically they can log in? No? Okay. Alright. So how do we treat the phacomorphic glaucoma? So mainly like any other glaucoma, we give mannitol, systemic acetazolamide, topical beta blockers, which is the main part of the treatment. We also do a laser iridotomy and ultimately cataract extraction and implantation of posterior chamber intraocular lens is considered to be the management of choice. Now, doctor, the next question, Bhupendra is supposed to answer this if he were to be there. So let us ask Prasoon, which is the carbonic anhydrase inhibitor that you use in the glaucoma?
Yes, sir.
Yeah?
Dozolamide.
Dorozolamide? Very good. So, absolutely. So, dorozolamide
Yes.
is a carbonic anhydrase inhibitor and use it topically, as all of you know very well. But one point that you need to know is dorozolamide like agents, how do they function? Carbonic anhydrase inhibitors. They basically lower the intraocular pressure by inhibiting the aqueous production, aqueous humor production is what you need to remember. Now, maybe one thing what you can do is you can keep your mic off and while speaking you can make the mic on. That's a better option, right?
Okay.
Yeah.
Yes.
Now, in place of Abhishek, who is going to answer this question, vertically fixed mid-dilated pupil. Yes, Ramanuj and Prasoon Vaidya. While speaking, you on the mic.
Yes, sir. It is angle closure glaucoma.
Angle closure glaucoma, very good. Absolutely right. So, dilated, unreactive, vertically oval pupil. That's what you see with severe corneal edema. Similarly, ciliary congestion, shallow anterior chamber. So these are all the features of the acute congestive angle closure glaucoma is what you need to remember. Now, the next question, Sandeep is not there, but Prasoon is going to give an answer. In case of angle closure glaucoma, what is the shape of the pupil?
Vertically dilated.
Vertically dilated? Yeah, very good. Now, a 50-year-old female presented with redness, painful, sudden loss of vision. She also claims that she is seeing colored halos. So, what is your diagnosis, Dr. Ramanuj?
Sir, it's acute congestive glaucoma as her symptoms are very acute and sudden. So we can go with answer option C.
Absolutely. Acute congestive glaucoma because in this case, the presentation is acute and colored halos is another important clue. Now, Prasoon Vaidya is going to answer primary open angle glaucoma. How do you treat it, doctor?
So by trabeculectomy.
Sorry?
So option B, trabeculectomy.
Laser iridotomy? No, no. What's the answer?
I said option B.
Okay.
B.
That's good.
Trabeculectomy.
Trabeculectomy? Very good. Can you please check is the voice loud and clear to the YouTube students? Yeah? Now, trabeculectomy, absolutely. So, if you look at the medical therapy for the glaucoma, the first line is prostaglandin F2 alpha analogs and beta blockers. Second line is alpha agonists, prostaglandin F alpha analogs and pilocarpine. And third line is pilocarpine and alpha agonists and carbonic anhydrase inhibitors. So that's what you need to basically remember. Now, I leave most of the literature. This session is supposed to be more you expressing the viewpoint, right? So that is the whole idea. Now, doctor, let's go to the next question. It was a very long discussion, yeah. Clinically, what is the earliest visual field defect in primary open angle glaucoma? Padma is not there, but yeah. What is your answer?
Option C, paracentral scotoma.
Very good. So it is a paracentral scotoma. The early glaucomatous changes are a vertically oval large cup, asymmetry of more than 0.2 between the two eyes, and pallor of the disc, splinter hemorrhages, atrophy of the nerve fiber layer in the retina. So these are all considered to be the early glaucomatous changes. Absolutely right. Now, what is the mechanism of action of acetazolamide in glaucoma? Prasoon Vaidya.
increase UV scleral outflow.
Sorry?
Increase UV scleral outflow.
Absolutely, absolutely. So you should remember that no, in case of
Increase.
estazolamide, just before we discuss no,
It is,
dorazolamide,
Increase.
estazolamide, yeah. What do you say,
Sorry.
Ramanaj?
Yeah.
yes, sir. I just wanted to correct her that it's decreased aqueous production.
Absolutely. So the first line of treatment of advanced open angle glaucoma. What is your answer, Ramanaj?
Sir, it's latanoprost.
It is
It's prostaglandins.
prostaglandin.
Latanoprost.
Absolutely. So, as we have just before discussed, latanoprost is the most important part of the management. Now, Prasun, what is the safest anti-glaucoma drug in children? Any guess? Quick answer.
Dorzolamide.
Very good. Dorazolamide is considered to be the safest.
Dorzolamide.
Yes. Dorazolamide is considered to be safer in pediatric population. Now, which drug is contraindicated in a glaucoma patient who is suffering from bronchial asthma? Ramanaj.
Sir, by law of deduction, I'll go with timolol
You like to say? Timolol?
malate.
Timolol?
Option A.
Yeah, it's an easy question because beta blockers are contraindicated in bronchial asthma is no brainer to crack.
Bronchitis.
Now, the next question to Prasun. A child of 18 years present with swollen watery eyes. Examination confirms glaucoma. Then what do you want to do?
Gonioscopy.
You like to say gonioscopy. What do you say, Ramanaj?
Sir, it should be, I'll go with surgery.
Surgery?
Management we should follow.
Okay. So, absolutely, it is a surgical management which is most important. Now, the next question. In this given case, bilateral big blue eyes in the image are all because of the increased what? Increased IOP. So, how do you want to treat?
Sir, it's again case of glaucoma, and we will go with trabeculotomy.
Very good. So, typically, trabeculotomy is considered to be the choice in this given case. So, what are all the important indications of trabeculotomy? Is a favorite question of the examiner. Primary angle closure glaucoma with peripheral anterior synechia involving more than 270 degrees is an indication. Similarly, generally primary open angle glaucoma means we give medical management. So, if it is not amenable and controllable with the medical management, so that is another important indication. And any congenital developmental glaucomas where trabeculotomy and goniotomy, wherever the goniotomy fail, so that is the point. And secondary glaucomas also wherever medical therapy is not successful, that is an indication for doing trabeculotomy is what you need to remember. Now comes Prasun's favorite question. What is the treatment of angle closure glaucoma? Parrot
Sir,
like answer.
laser. Laser iridotomy.
Laser iridotomy, very good. So absolutely, this laser iridotomy. So if you take angle closure glaucoma, it can be primary or secondary. So in the secondary, you get neovascular, inflammatory, or iridocorneal endothelial syndrome, etc., etc. So closed angle glaucomas, fundamentally what is the problem? Shallow anterior chamber, and typically that forces the root of the mid-dilated iris forward against the trabecular network. and that obstructs the drainage of the aqueous humor, and that increases the intraocular pressure. So that is a main challenge. So in the case of angle closure glaucomas, you need to provide a drainage for the aqueous humor. That's the reason you make a nick, create a hole, and then push the aqueous. So that's the reason laser iridotomy is considered to be the management of choice. Now, doc, there are a lot of things. I leave all this PowerPoint in the onlinembbs.com. So now, laser iridotomy, where is it useful, Dr. Ramanaj? Just before we said.
Sir, it's again repeat question, angle closure glaucoma.
Absolutely, angle closure glaucoma. Now, in acute congestive glaucoma, the best prophylaxis for the other eye, sure, Prasoon.
Topical steroids?
Yeah,
I'm not sure.
you're not sure. Okay, Ramanaj will be sure about it.
Sir, it's again laser iridotomy. It's
That's
kind
right.
of
That's right. So, laser iridotomy